Hello everyone, this is Dr. Nihma. Today we're going to discuss about pyelonephritis. What is pyelonephritis? It is the inflammation including the renal pelvis, the tubules, interstitium, etc. So there is two types of pyelonephritis: acute pyelonephritis and chronic pyelonephritis. Acute pyelonephritis, it is predominantly caused by the bacterial infection, and it is often associated with the urinary tract infection. Chronic pyelonephritis, it is mainly caused due to vesicoureteral reflex, and it plays a major role in that. Let's discuss about the pathogenesis. So the pyelonephritis, it is caused by the gram-negative bacteria, which are normal inhabitants of our intestinal tract. 85% of these cases, it is most commonly caused by the Enterocoli bacteria, followed by Proteus, Klebsiella, and Enterobacter. So in immunocompromised individuals, what happens is that polymyositis, adenomavirus, cytomegalovirus, these are the major causes of pyelonephritis. Routes by which bacteria can reach the kidney. So there are different ways by which this bacteria can enter the kidney. So there is less common way, that is hematogenous spread. It can be through septicemia or emboli from an infective source such as an infective endocarditis, and the most common route is ascending infection. So bacteria, first in the perineum, it will enter in the urethra, then into the urinary bladder. That's how ascending infection occurs. So for the bacteria to reach the urinary bladder, the colonization of the bacteria, it occurs in the distal urethra first, and then this colonized bacteria reaches the urinary bladder via catheterization or immunization, which causes the cystitis, that is infection of the bladder. So in the absence of catheterization, what happens is, due to urinary tract infection, which is a more common cause in females, because females have more shorter urethra, so they are more prone to UTI infections, and as like in males, they do not have prostate secretions which have antimicrobial properties. Also, these females have hormonal changes which affects the adherence of this bacteria to the mucus of the intestinal wall. Due to urinary tract infection and urinary bladder dysfunction, there is urinary stasis inside the urinary bladder, which provides a favorable medium for the bacteria to multiply and grow inside the bladder. Then this contaminated urine reaches the renal pelvis via vesicoureteral reflex. So from the pelvis, it reaches the renal parenchyma via intrarenal reflex. So once the bacteria reaches the renal pelvis, what happens is they adhere to the uroepithelial cells using fimbriae. Okay, now let's discuss about the complication of acute pyelonephritis. There are three major complications, which are papillary necrosis, pyonephrosis, and perinephric abscess. So papillary necrosis, it is the ischemic necrosis of the renal papillae. The risk factors include diabetes, obstruction, sickle cell disease. The papillae will become shrunken and grayish white necrosis can be seen. In the case of pyonephrosis, there is total or complete suppuration of the kidney. The kidney will get filled with pus, and the renal pelvis, calyces, and ureter, everything gets filled with pus. Perinephric abscess is the extension of the suppurative inflammation through the renal capsule into the perinephric abscess, perinephric tissue. Let's discuss about the clinical features. So there is sudden onset of pain at the costovertebral ankle. We can see a flank tenderness and fever, chills, malaise, dysuria, painful urination, and frequency and urgency of micturition. That's all. Thank you for watching.